Radiation is typically treatment with high energy X-rays. You can't see it, you can't feel it, it doesn't hurt, and typically there's no skin burn. I like to make sure that's very clear to all of my patients. In fact, sometimes there's a misconception that you might be radioactive or at risk to others, but there's no radiation that stays inside of the patient when you're undergoing treatment with typical external beam radiation or X-rays. That's a very common question. So most radiation starts with a CT simulation or a planning scan. And that's essentially a time where we have the patient in some immobilization device to try to help set them up the same way every day, whether that be a mask or a bag that they lay on. And then after that, there's a complex radiation planning process that goes on behind the scenes. But once the patient comes in, it's typically once a day, Monday through Friday, no weekends or holidays, and typically a pretty quick turnaround time from when you show up to when you leave. It's actually the therapists who deliver the daily radiation treatments. They will help assist the patient onto the treatment table, which is not enclosed like a scanner. It's actually open, so there's no issues with claustrophobia. And most of the time is spent taking images to make sure that the patients are in the exact same position every day. We take a lot of, go to great lengths to make sure our radiation plans are accurate down to the millimeter. And so we make sure that we set up the patients the same way every day in order to have the benefits of such a good plan. I typically see my patients once a week and check in on their side effects, answer any questions they have, and go over what to expect.